My name is Mwamba Chivamba, and I am the Program Officer at NSERC for this program. Encouraging Vaccine Confidence in Canada is a tri-agency science promotion initiative which aims to support activities that promote vaccine confidence in Canada. Next slide. I'm joined by a few other members of the team involved in the development and delivery of this program, who are here to help answer any questions that you may have at the end of the presentation. I'm also joined by representatives from SSHRC and CIHR. Please send in your questions through the Q&A text box at the bottom right corner of the WebEx interface, and we will answer them at the end of the presentation. Please note that this session will be recorded. We will email you a link to the recording within a couple of days. If we do not have enough time to answer your questions, or if you have questions that relate to a very specific situation, for example, you can email your questions to us afterwards at promoScience@nserc.gc.ca. Next slide. The purpose of this session is to provide you with an overview of the Encouraging Vaccine Confidence in Canada initiative, the application process, as well as the selection criteria. The information that we will be discussing is all available on the NSERC website under Information for Science Promoters. Next slide. Next. So the Encouraging Vaccine Confidence in Canada grant supports activities that promote vaccine confidence in Canada. It is expected that funded activities will, 1, mobilize knowledge to improve public understanding of vaccines and help Canadians to make evidence-based decisions, especially among populations that are hesitant about vaccines, and 2, encourage participants to become discerning consumers of natural sciences and engineering, humanities and social science, and health information. Next slide. So the program is expected to be in 2 themes. Activities should address at least one of the following 2 themes. The first theme focuses on sharing information and activities that will create and disseminate information or make it available and accessible. And the second one aims more to develop capacity and leaders in the community who will have a long-term role in promoting the acceptance of vaccines. Examples of eligible activities include providing scientifically sound information about vaccines via social media, hotlines, webinars, forums, or websites in a way that addresses beliefs and fears, developing, translating, and disseminating easy to understand and engaging materials on vaccine acceptance and adoption of public health measures in a culturally appropriate way, delivering workshops to train community leaders on promoting vaccine confidence and sharing best practices for evidence-based decision-making, mobilizing social sciences and humanities knowledge to address cultural and societal determinants of vaccine hesitancy in order to better ensure vaccine confidence, sharing historical perspectives on pandemics and vaccine development to build trust and confidence in the community, and providing techniques for identifying reliable sources of information versus misinformation pertaining to vaccines. Organizations are encouraged to consider the needs of official language, minority communities in their area while developing activities, and to strive to have official documentation and promotional materials available in both official languages. Next slide. So who can apply? You can apply if you're a Canadian registered nonprofit organization, a post-secondary institution, a non-federal museum or science center, and also have experience in communication related to science, humanities, and social science and/or health topics. So the experience in communication can be such as existing relationships with target audiences, examples of numbers of people that have been engaged, or more importantly, demonstration of impacts of previous efforts, for example, what was accomplished. Information that could be included to show this is such as summary data from an organization's annual reports, highlights from events or engagements with associated data, such as numbers or the impact, as well as short testimonial statements. Next slide. All activities should be interactive, that is, involving actions or input of the participants, and should be delivered to a relevant subset of the Canadian population, which you will define in your application. Certainly in the context of the pandemic, this might look different than what it would otherwise have been. For instance, it might mean creating content for teachers, online webinars, virtual workshops with youth, online conferences, or development of online interactive resources. Collaboration with trusted community leaders is strongly encouraged to ensure activities are appropriate and designed to reduce and/or remove barriers, particularly in instances where the intended audience is an underserved or vulnerable group. In the case of youth, this could mean working with a teacher. It could also mean a researcher from a university developing online content in collaboration with a public health organization, or working with trusted staff in homeless drop-in centers, newcomer centers, local faith groups, community centers, elders, teachers, etc. Funds may be used for new activities. However, not all initiatives need to be novel or new. Existing activities may be expanded, such as making them geographically or culturally relevant to new groups, and thereby increasing the scope of what already exists. While the aim of this call is clearly relevant in the context of our current global pandemic, the funds can be used to support the promotion and communication broadly in support of vaccination, or more specifically at an individual type of vaccination. Please note that research is not eligible for funding. Next slide. Next. Okay, so what is the value of the grant? Up to $50,000 to be used over a 1-year period, and the grant is non-renewable, and the expected start date is 1st July 2021. Next slide. So grants can be used to cover operational costs such as staff and personnel salaries, materials, supplies, or translation, as long as they are essential to the delivery of activities supported by the grant. Meals, travel, and accommodation for participants in the activity are also an eligible expense where or when circumstances allow. Items such as tobacco and gifts to elders are also eligible expenses as honoraria. Next slide. Grants may not be used to support research, as earlier mentioned. In addition, grants cannot be used to cover expenses, to cover costs for program evaluation, as well as salaries or stipends for participants in the activity. For further details on the eligibility of expenses, see the use of grant funds section of the Promo Science Grants Guide, which will be used for this funding opportunity. Note that the information in this guide may change without notice. Next slide.